Thank you, and welcome to our March Board Insurance Committee meeting. We have myself and Ms. Mason present, and Mr. Edmond was unable to make it today. So, Ms. Christie, if you will please record that. All right. Item 2.1, review and approval of the Board Insurance Committee meeting minutes from the February 11th, 2026 meeting. Ms. Mason, you...
Motion to approve.
All right, and I'll second, because that's the only option. Is there any public comment on February's meeting minutes? Hearing none. All in favor?
Aye.
Aye. Any opposed? Motion carries. All right. Item 2.2, discussion and or action regarding the Gallagher report. Gallagher, if you please come forward, introduce yourselves. Please make sure the microphones are on. Speak clearly into the microphones, and welcome. Thank you for being here today.
Good afternoon. Thank you guys all for being here with us today.
Good afternoon.
We're excited to share some updates with you.
You go ahead.
You're good? Okay. We're excited to share some updates with you all today. I'm so quiet, I'm sorry. So we're going to share some updates with you today, including some of the insights from our recent wellness market scan update. While our wellness consultant wasn't able to be here today, I'm going to be sharing some of her insights. Any questions that we're not able to address here today, we'll be able to take those back to our team for further review. So we're going to flip down to
I don't
our
want to interrupt you, but just in case you were not going to start there, could you please explain to us the definition of and what a wellness plan is, so that we can start off with that foundation, and then you can go into the particulars that you have here for us.
Absolutely. So a wellness program is meant to engage the employees into a healthier lifestyle. It is meant to engage them both with actions that they're taking on a daily basis, as well as for the district to focus on looking at the embedded programs that are in place and helping them to utilize those programs that are already there to help engage cost savings, both for the member and for the plan. So on this slide, what we're seeing is a highlight of the results of the market scan. We worked closely with the administration to review our vendors. We wanted to make sure that they were going to align with the culture, goals, and existing benefit structure that LPSS already has in place today. That was very important through the process to make sure that those things were aligning. Our focus was to identify solutions that would integrate seamlessly into the programs that we have in place. Think TRIA and Regenix, those two programs that are meant to offer cost savings to the district, to the plan, to the members. We wanted to make sure that these programs or these vendors were going to be able to integrate with those programs. We wanted to make sure that these vendors were not going to duplicate efforts, but enhance the efforts that were already in place, and then, of course, add to it. We also wanted to ensure the platform had the flexibility to not only support the active population, but also support the retiree or non-Medicare retiree population as well. That was another key focus as we looked at all the vendors that we could go with. So we're going to go ahead and flip to the next slide. This slide is going to give us a highlight of the analysis of the 4 vendors that we identified through that wellness market scan. The core components that we looked at, you're going to see up here on the screen. So gamification. When you think gamification, think about ways to make healthy behaviors more interactive, making it fun, making it approachable, giving employees a reason to engage in the program. Push notifications, preventative care tracking, ecosphere partners. When you think of that, think of things like Instacart, eHealth, Headspace, Mindspace. All those added programs and apps that can be included or incorporated into the program. Single sign-on, we want the user experience to be a friendly one, an easy one. Integration with benefit landscape. That was another important one. The ability to ingest claims data to personalize the experience. A key takeaway there is you'll notice in the 4 vendor lineup that we have, Meritain is one of those vendors. That's your existing TPA today. Note that any claims data with Meritain would operate simultaneously because that is your existing TPA who is managing those claims. With the other 3 vendors that you see listed there, the claims integration is available, but again, there would be a requirement to have a data feed there. So that was one of the differences between the Meritain and the 3 other vendors that you see there. We also looked at the ability to offer a rewards mall. Think of that as incentives for employees to participate in certain programs or aspect of the program and get rewarded for that participation. Peer-to-peer recognition, allowing other members to recognize their peers. User training for leaders and employees. What's good of a program if we don't have those leaders that are in place promoting it and educating, and if the employees don't know how to use it or the members or participants don't know how to actively engage in the program, it's not going to go very far. So making sure that we have those training resources available with each of these vendors. And then, of course, you're going to see there the on-demand fitness library. We all like to get in shape. We want to make sure that's available for members. And then pulse and engagement surveys. You'll see there that some of our vendors offer a more standardized survey option, and then others a more customized option. So the key takeaway on this slide is that each of these vendors are going to offer a comprehensive, modern wellness experience for all of the participants. And again, they're all going to engage with those programs that the district already has in place for cost savings, both for the member and the plan.
Just to add to that, the wellness plan that we had in place before, which really wasn't a wellness plan, it was more of biometrical screening, had been in place for quite some time. And I know there was value to it, but it wasn't a wellness plan. It was more of it was something that you should be going to your doctor to get done as opposed to coming into the school. So basically they would prick you in the finger, do some basic blood tests. And of course, if you had off vitals, then there was something to be talked about. But different here is we're talking about a full-blown, holistic wellness plan that engages folks to be healthy, not a reactive, but a proactive process.
Absolutely. Okay. So on the next slide, if we want to move. So now we'll just kind of take a deep dive into the estimated pricing. We are referring to this as estimated pricing. Right now, we do have this pricing from the vendors, but once we dive in and pick our best and final options, we'll go back and we'll negotiate contracts and pricing at that time. So you're going to see here that all 4 of these vendors are offering a pricing model that is on a per employee per month basis, with our highest cost being with Meritain, our current TPA today, at $5.61 per employee per month, as low as $1.84 with Vitality. So a key note here as we get into the added benefits that we could add on to the program is that, one, that these per employee per month rates are only inclusive of the technology and portal fees. So any of those additional PEPM rates that you see there listed below, that would be in addition to. So that would be something that we could always add to the plan later on. Another key note here is that with Meritain and Wellright, it is important to understand that they both use the same platform, meaning the technology that is used behind the scenes to administer both of those programs is the Wellright system. So they are both using that technology. The estimated fees that you see listed there in orange, again, that is essentially looking at that per employee per month rate for the technology and portal fees only. And those could change. Obviously, enrollments change. And again, we're going to kind of go back to these vendors once we've narrowed it down to a few select vendors of these choices, and we'll come back with final pricing at that time.
So one of the things I know that we're going to be wanting to talk about as this progresses is what have your other large, preferably school system customers, put in place, and how does it compare to what you are proposing here? Because, you know, I think we all knew that there would be some cost to implementing a wellness program, but what's the return? You know, what's the typical return on investment? You know, if it costs $134,000 to implement, but it saves us $500,000 in costs, healthcare costs, then, you know, we need some benchmarking on that. And we don't need it, you probably don't have it today, but that is definitely something that I know I'm going to ask if we're going to be looking to spend this kind of money on a program. Does that make sense?
It does.
Okay.
It does, and that's fair. And I will tell you too, from a return of investment standpoint, that is another key component of us making sure that the vendors that we've looked at for LPSS, to make sure that they are going to incorporate with those programs like TRIA and Reginex, to make sure that we are getting the most utilization out of those programs. That's going to be very, very important of making sure that we're getting some added savings from that angle.
You have anything at this point, Ms. Mason? You good?
So on the next slide, we're going to look at biometric and flu shots. Keep in mind that our goal was to enhance the program, right? Add to it, not take anything away from anything that members are getting today or we're getting in 2025. And so part of that is the on-site biometric screenings and flu shots. We focused on those two key areas. You'll see there that there are some other areas that we looked at as well. But again, our focus here was biometric screenings and flu shots, just to make sure we were, again, not taking anything away from what the members were used to having before. Our pricing is listed there. That is a per participant per month pricing model. And again, this will be revised. We'll look at this again once we come down and pick the best and final vendors. Does anybody have any questions? I kind of stuttered through that a little bit. No questions? That makes sense. So now that we've kind of looked at our options, what our vendors are that we looked at, and we've kind of talked about pricing, the next step in the timeline is for us to, again, choose those best and final. Who do we want to go back to? Who do we want to look at a little closer, dive into all those key components that we talk about, and actually demo the system? Which vendors do we want to look at that and give that opportunity to come back to us with a one-on-one session? So that would be the next step. That would be the next step in the process. Our end goal is to allow the program to be ready to go live for a January 1st, 2027 effective date. And again, that would be for our active population as well as our non-Medicare retiree population.
Superintendent, I know that you and Ms. Gardner and Ms. LaBeouf have had pretty deep conversations about this, I guess, over the last week. Clearly, Meritain is way out there, which I don't get. They're our current provider, you know, but it is what it is. What's the, kind of tell us if you don't mind, kind of where y'all head is on this to narrow it down, because you can't bring them all back to the table.
Do you want to go back?
This is what my thoughts are, is that
Maybe for them
we look at the first, number one and number two, whoever those people are, and let's have individual interviews with those individuals and talk about what they can do for us. And to me, we make a determine where that is, and we just bring it back to you guys, and we can move forward. Do we need to bring it back to this committee, or can we bring it to the board?
I would think that it would need to come to this committee, but, I mean, what are your thoughts?
Well, if it was pressing for time, not, but if we're not pressing for time, this is something we're looking to implement
Well,
in January, we have plenty of time.
Well, so we do want to implement this for January 1st of 2027. However, I would think that the district would want it to be available to discuss with open enrollment materials. And so if that's a consideration, if that's something that,
Plenty of time. We can bring it back to you. it still leaves us plenty of time. We can bring it back to this committee for a recommendation to the board. I guess the question is, how do we want to move forward on narrowing this down? They say 2 to 3. I personally would like to narrow it down to 2, because you're going to go back and you're going to really negotiate, so to speak, to get them to give their absolute best value.
Correct.
And so that's my opinion. And I don't know, Ms.
Well,
Mason,
I'm
go
just
ahead.
curious, so would they, I mean, if they're gonna present, I mean, they would need to present to this committee. I mean, would they be presenting to Gallagher?
You know, that's up to this committee to decide. In the past, you know, like Meritain and others, they presented to Gallagher. Gallagher's running the market check.
Right.
So Gallagher went out, talked to 10, 15 people, narrowed it down to the best 4 to 5 options. Then now it's at the point where it needs to get narrowed down again so they can go out and say, hey, look, you gave us your pricing, but we don't like it, so let's do better. And then it gets narrowed down to a finalist. That was the thought process on the process.
Is there a price tag with these?
So there's going to be a per employee per month fee based on the vendor that you
Page
select.
6.
Oh, sorry, thank you.
It's okay.
I'm a little lost.
That's okay. You can see Meritain, Ms. Mason is
Page 8.
way
Okay, thank you, sorry.
out there. Yeah,
Oh, my, yes,
it's almost a no-brainer.
yeah, it's hard to, were they aware? I mean, it's not even close.
I mean, they are not even around. Can you go, yeah, 377?
So to your point with Meritain being more expensive, the key note there, and again, I will say this, they are more expensive just in comparison. So, but not to knock them out right away, their claims, they are your current TPA. So they are your current claims administrator. So there are pros and cons to that. Pros being the claims are integrated. So for example, if you add in the biometric screenings, claims are going to flow simultaneously. If you're adding any type of premium incentive programs, it's all simultaneous. So you have one administrator that can see that actively as those claims are happening. So there's no data feed requirement. There's no timing between one vendor, Meritain, right, your current TPA, getting data over to one of your other vendors. But honestly, that really is the only variable. So as you're looking at these vendors and you're trying to narrow them down, Gallagher's recommendation looking at these were to look at Wellwright, which has a pretty inclusive system. We have a lot of clients that are utilizing the Wellwright system, as well as Navigate was another good one. But
See,
you
that's what we
can't.
need.
Yeah, see,
So that's what we need from you guys.
I would think that I would need like a, I don't mean legible, but like a more, I mean, like this is like a paragraph of different things. I would love to be able to compare these a little bit. Like, are they providing the same support, you know, or are they
Can you
offering completely different things?
So
look
page
at
5, Ms. Mason.
look at the component, not that one, the next one.
Um,
So on the side-by-side analysis, this is those added components, if you will, that these vendors are bringing to the table. So we did look at all of those components side by side, which with each of these vendors. And these are where the variables are. So they, again, they all are going to offer a comprehensive, interactive wellness interface for members and
Right.
participants.
So when we're looking at this, I would think that we would have to discuss like, what do we want? Maybe we have to send a survey saying, I mean, I don't know. It just.
I mean, looking at
But hard to
these,
compare, because, I mean, Vitality and Wellwright,
So that is where the demos are going to come in. So when the vendors come out or present and they actually go through a demo of their system, there may be things that you like in one system. Maybe it's the look and feel versus the look and feel of another vendor. So really, when you get to the demo stage, that's when you can really narrow it down based on what LPSS has in mind for its members and participants. We are happy to take back a note that you want to see more details. If there's anything specific that you want us to call out or to compare for these vendors, but I think the demo stage is going to answer a lot of the questions that you may still have.
So we know Wellwright and Meritain are on the same platform, same
Correct.
software platform, whatever terminology is.
Mhm.
And if you look at the side-by-sides, I can only assume that's where you got your recommendation from for Wellwright and Navigate, because those are the ones, outside of the cost for Meritain, those two have the most comprehensive ability,
Correct.
and they're very close in price. I don't know, Ms. Mason, I mean, we can,
I mean,
we
it's
can
a
narrow
huge
this
decision.
down. Well, I don't know if it's that huge. I mean, you look at it and, I mean, they check all the boxes with the exception of vitality on a couple.
Ms. Mason, I think why it's such a hard decision is all four of these carriers or vendors, they're reputable. We have other clients with each of these vendors that you see up here on the screen. They're all offering the same or just about the same resources, the same programs, the same interactive abilities for premium incentive, for example. The reward, like, it is so close in nature between the two. Again, getting to.
I guess what I'm worried about is, with such a big price discrepancy between Meritain and the other three, like maybe Meritain is bidding on, maybe their program does so much more that would be so beneficial in cost down the line. That's what I'm concerned about. Like,
I would
because
not.
these other ones are less expensive, or they just not as
So
good
if
and
you-
have worse outcomes?
Just
I'll-
looking at page 7, Ms. Mason, for the separate programming, the biometric and flu shots, Meritain here too is significantly higher than the others. So I have a feeling that that's just kind of
Just where it is.
where it is.
And I would also say that the other vendors that you see on the screen, that is what they do, is wellness. So Meritain is your TPA.
Okay.
They are, go
Okay.
ahead.
We do have someone in the audience that has a question. Do we want to entertain a question?
I know I'm on order.
Not normally, but, well, you're going to have to come to the mic, though. You'll
You
have to
can't
come to
hear?
the mic.
We can't hear. It's as simple as that.
Okay.
Most of us are retirees. They say the hearing is the first to go. I can verify that. Can y'all put up the volume?
We
Oh, yeah.
can.
I don't hear any of the discussion.
Can you hear us, or is it our presenters?
All of you.
Everyone. Okay. Can we up the volume a lot, please?
Thank you.
Okay.
That's all.
Thank you.
That's better.
Thank you. Gee. Okay, so at this point, what is you guys' timeline? Talk to me about this timeline so that we can figure this out on what decisions that, if any, need to be made today or not by this committee.
So our time,
We need it to be loud, so go
I know.
ahead.
So for our timeline, our goal would be to be able to move forward and let the vendors know who the best and final are. That's going to allow us to start negotiations and working on premiums and any changes that we're going to see there, as well as working with the mini schedules that we might have that are going to be involved with setting up the demos. So if we could have that done, and I'm looking kind of at Trish with regards to open enrollment, but if we could have that done sometime within the next, I would say, 3 weeks.
So we meet once a month in this committee, and I know one of the factors, it's not the factor, but one of the factors too, because we don't, we're not being presented with the budget yet, and this could be one of the factors. So, Ms. Mason, let's have a little bit of conversation on whether or not we want to narrow this down, or we want to send this back to the superintendent and his team to narrow this down for them to get working, because if they need something within 3 weeks, well, we don't meet again until at least 4 weeks.
Now, I would love to let the insurance department kind of analyze it, because y'all are so familiar with the day-to-day, and, this is going to affect everyone, so I think that they would be the most efficient, for sure.
Okay, Superintendent, if you can get this narrowed down with your team, with Ms. LaBeouf, you okay with that?
Yeah, let me just say that, you know, one of the things that you said, that Meritain, you know, is gonna be a smooth if they are the ones. But listen, I want you to make sure that Gallagher understands that Meritain is our TPA, and regardless of who we go with, it's their job to do what they need to do to make sure it's smooth. So I don't wanna hear anything about whether or not the board members, you know, pick this one or whatever. If it's not Meritain, it's not Meritain, but Meritain needs to understand that they are our TPA, and whatever this committee or the board decides on, they need to make it take care of, because if not, it will change that TPA.
Fair enough.
Well,
Yes,
my,
ma'am.
my question also is, Meritain very aware that this was a bid for our work that they already service? Okay. Maybe they don't want it.
I think the important thing she said earlier was, these other companies, this is what they do.
Okay.
This is one of the things Meritain does, so that could be a major factor.
Okay.
I'm trying to read between the lines. Help me out here.
Same.
No.
I don't want hidden costs to come back and bite us, or just poor service.
Correct.
So,
So I will say this, and I probably shouldn't.
Nope, you should. That's
No.
what we're here
good.
for.
This is a public meeting.
We agree with you guys 100%. The other three vendors on that list are probably going to be a better selection for the district. We do not see any concern to think that they are going to do any less than what Meritain would have done. It is just that key factor that, one, they do what they do best, which is wellness programs. Engagement, which is a huge factor when you're looking at a wellness program. And we also, just behind the scenes, our consideration is it's going to be an important factor to take into place that Meritain is your TPA. So what happens down the road if you decide to move TPAs? It's a lot easier to have your wellness program separated, where it's easier to move to your new platform, whatever that would be, that you would
Okay.
select.
That's a good point. Thank you. No, I mean, we've hired y'all to give us your best recommendations, so we really appreciate it. Thank you.
So you guys want us to just take two and bring it back?
That would be my
Okay,
suggestion.
Yeah, and I
Okay.
agree.
all right. We'll let you know what those two are, okay?
Thank you.
Okay, go ahead.
Just a few more updates, not a whole lot more of your time I'll take, but we definitely want to make sure that everyone knows that we heard y'all in the February BIC meeting. Like, we want to make sure y'all know, we heard about communications. We know that we want to focus on relevant, impactful communications for 2026. We know that we want our members to be educated and informed on those key things that are going to help them utilize the programs. I know we've been talking about that a lot today. So that is a key focus. I just want to let you guys know that although we don't have full updates for you today, we are working on that behind the scenes, and so we do have updates coming very soon. Also, talk about cost savings. We are reviewing currently, as we speak, with your programs, we are looking at what the ROI is. So we expect to have those in March, which we'll be discussing internally with administration, and then we'll have those to present sometime in early May. Okay. And then we've also, I know we talked about user interfaces, making things easy. We want to make sure that members understand their network availability. Your direct contracts, Verity, then Aetna, so we are looking at communications for that as well. Those things have already started to take place. And as part of that, we were looking at some custom search engine. We do have two viable options. We do have those proposals in hand. We'll be, again, looking at those with administration and bringing that back to the committee soon.
I want to thank y'all for working on that custom search engine updates. I don't believe we have a final product, but I know Ms. LaBeouf has worked really hard on that as well. And the little glimpse I've seen is what we needed. That's what we need. We need to get in the hands of the employees and the retirees, all members, easy to access information. So thank y'all.
Absolutely. And that is all of our updates for today. I mean, this is our annual service calendar. We all know that we have all the standard meetings that we'll be working on. Behind the scenes, I think our key takeaways here are working through the best and final, right? Getting those vendor demos set up, that's going to be important. And then looking at what is our ROI on those programs. I think that's what we all want to know. Gallagher is just as curious as you all are. And so that's our big focus for March.
So I'll go out on a limb and say this is one personal opinion, one committee member's opinion. If you look at this and you go deep into it like you have done with other customers, other clients, and you find that a wellness program is not beneficial for Lafayette Parish and there are other options, then we need to know that. We don't want a wellness program just for the sake of having one. I've heard of organizations that have them and they're very successful. Stellar, the list goes on and on. I've heard of organizations that have them and they're useless and they're a burden and they're a cost and folks don't use them. So I'd like you to consider that as you move through this process. And one more thing I'd like to discuss before we end or before we turn it over to see if Ms. Mason has anything. Budget. I know normally right now we're talking about budget. Superintendent, I'd like you to chime in. Whoever else wants to chime in. I know that it's a different beast this year. We're waiting on different data than we normally do, than we normally have, because we have individual contracts and things of that nature. So the budget conversation is being pushed a little bit down the road. Unfortunately, I mean, we still have time. It's just that normally, I know that we're normally talking about the budget at this time of the year. And normally we have a preliminary budget come back from the consultants. But did you want to chime in on that? I know that we're waiting on some information.
Yeah, I think that first of all, when you guys presented and want to make sure all the members of the public understand is that we made a lot of changes started January 1 as far as RX plans, looking at what we're doing as far as contractual with Acadian Ambulance, with Ochsner and so on and so forth. We're trying to make sure as much time goes by before we start making decisions as far as what this budget's going to be, because again, we're looking at some cost savings hopefully. And again, I know that our financial advisors and people are trying to tell us, let's be very conservative, but I want to make sure that whatever we are asking this board to actually adopt as far as the budget, it is something that it's around where we need to be as far as that, because I really believe that we're going to save some money as far as these contracts are concerned, and also the different changes that we made as far as RX is concerned. So I just think we need to kind of wait closer till at the end of April, beginning of May, and then we can get some real numbers from you guys and start seeing where we are, and we can make some cost savings as far as what it can look like as far as the year is concerned.
You guys have anything else?
No, that was it for today.
Ms. Mason?
No, thank you.
Okay.
Thank you.
Thank
Thank
you.
you, everyone.
Well, thanks for being here. We know, we don't like to meet just to meet, but I think we have a commitment that we need to be in front of the public at least 30 days. So thank you guys for being here.
Absolutely.
With nothing else left on the agenda, this meeting is adjourned.
Do I have an opportunity to speak or no?